Welcome to Inside South Union Township here on the South Union Township Network. Inside South Union Township is brought to you as a joint cooperative venture featuring Township Supervisors Bob Schiffbauer, Rick Vernon, and Jason Scott, Atlantic Broadband Cable, Armstrong Cable, and our friends at CUTV, including Gary Smith. We're continuing our segment on the COVID-19 outbreak here in Fayette County and around the nation. Joining us now is Dr. Jeffrey James. He's been a resident of the Uniontown area for the last 23 years and practiced at the Uniontown Hospital, where he's currently the Medical Director of Infection Control and Prevention. And Dr. James, we appreciate you taking the time to join us here on Inside South Union Township.
Well, thanks for having me here today. I really think there's some important information that I can help to get out, and it never hurts to reinforce all the information that's already out there.
And certainly a lot going on with this COVID-19 outbreak, and it certainly affected everybody.
Oh, that's for sure. I think, just to start with a little bit of a brief overview of what actually, we hear this abbreviation COVID-19, it gets thrown around a little bit. I'd just like to give a little bit of a background about really what we're talking about. So COVID-19 stands for coronavirus 19, actually coronavirus disease 19, and it's caused by a virus that we call SARS coronavirus number 2. By the fact that I said it's number 2, obviously there was a number 1, and that's indeed the truth. So back in the early 2000s, we had to deal with the SARS coronavirus number 1, and that created respiratory illness much like this virus. So this isn't a completely new virus, but it is behaving somewhat differently from the SARS disease that we saw back in the early 2000s. Now, fortunately, back at that time, we did not see much disease here in the United States. Mainly, there was some in Canada, mainly in China. In addition to that original SARS virus, we've had to deal with some other coronaviruses in the last few years as well. There's been a Middle Eastern respiratory syndrome caused by a coronavirus, causes respiratory disease. So we have had some experience with these viruses, including what I'll call regular coronaviruses that can circulate and sort of cause the common cold. But this new virus that we have, the SARS coronavirus 2, started in China, started probably in animals, and then from the animals it came into people, and then we sort of know where things have gone from there. It is a serious illness. I can't emphasize enough at how serious it is. A lot of people want to compare what we don't know to things that we know. So you've heard a lot of comparisons about whether this is like the flu or not, influenza viruses. And people always like to try to attach something that they know to something that they don't know. And that's helpful in the sense of it helps to calm some of our fears. But I will say, though, I do feel that this virus is more serious than influenza. I don't want to get too bogged down in numbers, and this is probably one of the few times I'm just going to throw out a few statistics. If we look at the mortality of influenza, and that means how many percentage of people that die when they acquire the disease, influenza rates are somewhere around 0.1%. Now that's a sort of a general figure. Definitely, if you looked at certain populations, older populations in the immunocompromised, those numbers can be a little higher. If we look at the new virus, the virus causing COVID-19, the rates are somewhere maybe around 1%. And then you hear a lot of people debate about that, and it's really not important to debate. It's just to know that the mortality right now looks as if it's somewhat higher than influenza. What the actual number is, we'll only know after this is all over. So focusing on that number right now is really not important. I think the thing that is important is that we all need to take this virus very seriously. And then just to give a little more context, if we take a person that has sort of a serious bacterial pneumonia, one that we can even give antibiotics to, the mortality range is somewhere 15 to 20%. I just can't emphasize enough that this is a serious virus that we need to take seriously.
Before we talk about the local impact, you mentioned the initial SARS virus. Why Was that virus able to be contained so well, and why are we seeing the outbreak here with the coronavirus?
Yeah, that's a good question. It's, there was somewhat of just luck in the sense that the virus itself sort of dwindled out a little bit on its own, and they're not exactly clear why that happened. It seemed as if that virus wasn't quite as easily transmitted as what this one is, and part of that may have been due to the fact that there weren't as many asymptomatic people that were able to transmit the virus. They've not worked all this out yet, but those are some of the facts that they're sort of thinking as to why this virus may be a little more easy to transmit and spread than that virus was.
Let's talk about the local impact here today in Fayette County. We're taping the show on Thursday, March 31st. We saw 3 new cases of COVID-19 announced here in Fayette County, up to 14 now countywide, and over in the whole course of the state of Pennsylvania now, over 700 new cases just reported today. So we're continuing to see this grow locally and statewide.
Yeah, I agree. I mean, to go through the numbers every day is we right now expect them to just keep rising. I mean, I think in the whole country we're over 140,000 cases. That was the numbers. I mean, the numbers that I saw yesterday, deaths are about probably over 2,000, definitely over 2,000 now. And here locally, definitely Allegheny County, a more populated area, more people, more densely put together. They've had close to 300 cases. They've had a few deaths up there. Here in Fayette County, as you mentioned, numbers yesterday were 11, today probably 13, 14. So the disease is out, it's around us. At this juncture we'd have to say that it is spreading in the community. If we looked back 6-8 weeks ago, we were only worried about cases that were being brought in from other areas. But now the disease, the virus is spreading in our community.
Do you actually think we're seeing a community spread, a real community spread here in Fayette County?
I do believe we're seeing community spread here in Fayette County. I can't give you the exact specifics of why that is. Just seeing what I see and knowing what I know, I could say that we're definitely, these aren't just cases that have been sort of imported in from other places or directly directly connected to an outside case. So I do believe there is community spread occurring here in Fayette County. Hopefully not as much community spread that's occurred in some bigger urban areas. I think the fact, and something that you'll see, is that more rural areas where the population is less dense, we're seeing lower numbers. I think there's not as many people that have traveled outside the area, not as many people that may have brought the virus in and then had the opportunity to spread it in the community. So that is one of the benefits of living in a smaller, more isolated community.
What's being done locally to help contain that spread?
Yeah, so there's sort of multiple layers of what is happening out there. First on the sort of state and federal level, we have the public health departments, we have the Pennsylvania Department of Health, which really is working in conjunction with the Centers for Disease Control and the federal authorities. And I think we've all seen all of the guidance that they have given. I mean, there's information on their websites, both the Pennsylvania Department of Health and the CDC, that give us guidance across a whole range of areas, from what do we do in a hospital, what do we do in a nursing home, what do we do at dialysis centers, what do we do as an individual at home. There's been a lot of guidance given, and then there's also the directives that have been mandated from the governor as far as closing businesses and what can stay open, what can be closed. So all that guidance is sort of coming from state, local authorities. So then what do we do here more at the local level? We look at what the medical community is doing, the hospital. I work at Uniontown Hospital, and I say that we have been working over the last several weeks, even before this started, this specific disease started to hit. We really periodically run drills regarding certain infectious diseases. Now, we never know exactly what new thing may come down the road, but we try to model preparation after some known things. Actually, one of the more recent topics was the measles, and so we had been actually preparing for and drilling on measles preparations, and actually this virus being a respiratory virus, and given that it spreads similarly, although thankfully doesn't spread as badly as the measles, we sort of were able to sort of use that information and build on that to create our policies as to how we deal with it at the hospital. I've been very pleased with the response from the top to the bottom. I mean, it's sort of all hands on deck, from administration to nurses to all the support personnel, that everyone, you know, feels informed, they know what their jobs are, and I'd have to say that, you know, it's done really without much in the way of complaint. So I've been very, you know, pleased to see that.
And I know you aren't able to talk about any specific cases,
Sure,
but you've
sure.
had a couple of cases of coronavirus at the Uniontown
So
Hospital.
we're past the point of preparation as far as anticipating. We've had, you know, at this juncture, there have been people that come in with symptoms, respiratory symptoms, that have to be considered as having potential to have that. So they have to be treated until, they have to be assumed to be positive until they're, you know, tested and found to be negative. So we have all the proper precautions for the isolation they need to be in, the proper equipment, we call it personal protective equipment, that the staff have to wear. So yes, we've dealt with that, but also dealt with actually real cases. So it's sort of, it's past the point, we've done all the preparation, and now we're gonna see real cases. We're seeing suspected cases, and I really anticipate seeing more cases that we're really going to have to deal with.
I think you've done a nice job isolating some of the suspected cases or possible real cases from some of the folks that might be into the Uniontown Hospital or the emergency room for something else.
Right. I mean, and I think that's important for the public to know, that it's safe to come to the hospital. If you have another medical problem, be it you're experiencing chest pain and you think you're having a heart attack, or if you think you're having a stroke or other major problem, you can safely come to the hospital and be cared for. We've done a very good job of separating out how we manage and evaluate patients with these kind of suspected symptoms, and to the best of, you know, anyone's ability, have arranged ways in the facility to keep those people separated. We have a separate floor that we were able to clear out of other patients, that we're able to house these patients in their own individual rooms, with all the staff there wearing all the proper equipment. And so we've been able to keep the people that we suspect may have disease or definitely have disease separate from the rest of the patients.
And I think it's very important as well, because you don't want folks to not come and get treatment that they actually might need just because they have the fear that they might get infected with COVID-19.
That's very much true. That could be sort of a unintended consequence of the virus, where, you know, although you're not sick or dying because you have COVID-19, now you're delaying coming to the hospital because you have a fear of coming to the hospital, and you're going to sort of dismiss your chest pain, or you're going to dismiss the symptoms of a stroke. So I highly, you know, if you have a problem where you, excuse me, sorry.
That's all right. Of course, you're always busy being a doctor. That's expected all the time. You're always on call.
Turn that off. Yes, the message there is, if you have a problem that you ordinarily would have come to the emergency room to seek care, a serious problem, then, you know, I feel safe that you're going to be safe there. And I actually personally feel probably safer when I'm inside the building, other than being in my home or driving in my car. I probably feel the safest of it if I'm inside the building, because we have measures in place, and the really, you know, goal is to protect everyone, not just the patients that have this illness, but those that don't.
Let's go back to the basics. How does someone contract COVID-19?
Yeah, the main way that, you know, this is a person-to-person disease transmission. So the main way you'll hear this word droplet spread. So what does that mean? Well, when we cough, when we sneeze, even when we talk, there are droplets of moisture that come out of our mouth. Primarily, mostly if we're coughing, if we're sneezing, then that is when a lot of droplets are created. Those droplets can then travel. If I was sitting here, if I was coughing, sneezing, those droplets, typically we say they can travel about 6 feet. So,
And we've tried to maintain 6
yeah,
feet.
we've measured it out. So, those droplets can then, it sort of sounds gross, but those droplets can land in your mouth, on your lips, on your nose, in your eyes, and it's mainly the contact then with your mucous membranes that virus can get a foothold and it can infect you. So that's what when we say droplet spread, that's what we mean. It's the moisture, that droplets that come out of our mouth and come out of our throats, mainly through coughing, sneezing. There can be to some degree when you're talking, but much less so if you're just talking. Singing might be a way that you can create a lot of droplets, and I was told today there was just some choir in a part of the country where a number of people that were at choir practice got infected from just a few individuals. So that was probably a perfect storm. You got a whole lot of people all together, one on top of another, and they're singing.
And then you actually had a church, I think, down in Florida. They held services for some unknown reason this past weekend as well. So
then those droplets typically fall to the ground or fall on, using us as an example here, if I'm coughing and sneezing.
I'm at my cell phone here.
Yeah, then, I could, these droplets, and the droplets I speak of are not necessarily so large that they're completely, visible to what we're seeing. And so then the virus that's in the droplets can deposit on the table, and if you come along and you're touching with your hands, then you can infect yourself. Now, one thing I want to make clear is the touching part, and this is where the contact part comes in. So you're touching the secretions that I've sort of coughed onto the table. The virus doesn't go through the skin of your hands, okay? So the skin of our body is a very good protector of us. So it's not like we're not getting it because we're touching something and the virus is going through the skin. It's because we're touching something and then we're touching our faces. We're touching our nose, we're touching our mouths, where the virus can then contact these areas of our body, what we call the mucous membranes, the inside of your mouth and nose.
And that's always hard to train yourself not to touch your hands and your face, because we all get so used to that through the course of our everyday living.
They've actually done studies to look at how long, like observing people, and it's actually, the number is sort of unbelievable as that when someone's being observed unknown, how many times they actually touch their face. So it requires a conscious effort to actually not touch your face. So that's why there's been so many recommendations about, okay, why we want to stay 6 feet apart. The science behind that is these droplets typically fall within 6 feet, so it's less likely we're going to get that direct droplet in our mouth or our nose. And then, hand washing, just to wash those germs off your hands so that you're not then touching your face. Later on, well, I might as well talk about it right now. There is the issue of, are you protected by wearing gloves? Well, when we work in the hospital, we wear gloves for a variety of reasons, because we may want to be protected from some of these things that actually could cause us infection through our skin. But we're actually wearing them for very short periods of time, changing them frequently, washing our hands often in between times we change the gloves. But for a person in the public, if you, say, go to the grocery store and you enter the store with a pair of gloves on, pretty soon after you start traveling through the store and touching things, those gloves are the same as the outside of your hand.
Correct.
So there's no benefit to wearing a pair of gloves unless you almost change them constantly. And
Is there any difference as far as the amount of time the virus is going to live on gloves, your hands, your table?
No, pretty much not. The gloves aren't magic. The glove isn't going to kill the virus on this. There's nothing there that as soon as you touch something and the germ's going to die on the glove. The glove becomes the outside of your hand. So you can wash your hands, but you can't put your gloves under soap and water, and you can't use hand gel. So so basically if you went to, while people may feel safer wearing gloves, they're really not, because within a short amount of time of touching things, that glove is no different than the outside of your hand. And I think some people mistakenly think that maybe the germ's going to get transmitted through their skin or through their hand. That's not the case. So I think you can do yourself a disservice, actually, by wearing gloves, because you feel falsely protected. you'd be better off just using some hand gel and sanitizing your hands as soon as you can after you've been places and touched different things.
How long does this virus live on surfaces?
That is, there's many answers to that question.
Okay.
The short answer is it can live for, definitely several hours on a surface. The reason I said there's many answers because it depends so much on what the surface is made out of, how much virus was in the droplet. Not every person is the same as far as the amount of virus they're going to produce if they're ill. How much is in each drop? So there's a lot of variables there. So when they do these studies, they measure it out and they do what's most common or what they think's most common. So on average on sort of solid steel surfaces and plastics, they've measured that out to maybe for a day. Cardboard and some of these other softer material, probably less. Not even that long.
But still, it's a very long
So
period of time.
it's more than it's not like it's more than a few minutes. So easily you can see how coming along after somebody you can become infected from touching those items. Now, how much of part that plays in the transmission versus being directly coughed on, again that can be variable, but it does play a part. But I don't want to. There's been, concerns about, well, could I get this from the mail or could I get this from packages? There's been no evidence to show that there's been any disease spread from, the packages or from your mail.
That's good. That's good.
It's one thing to demonstrate that, yeah, we can maybe find something on a package, but the question is at that point, is it even the virus well enough, I'll use that term loosely, well enough to infect somebody? So there's a lot. So the bottom line on that is if there was evidence that it was getting to people in the mail and through packages, there'd be sort of some different spread patterns, and we've just not seen that.
We're talking to Dr. Jeffrey James from the Uniontown Hospital here on Inside South Union Township. We'll take a quick break and be back with more right after these messages.
Davis and Davis, helping the injured.
If you're injured in an accident, after you address the medical problems, you're going to be faced with numerous questions concerning who's going to pay your medical bills, your property damage, the wages that you might be losing if you can't go to work. These are things that you need counsel for.
That your income is protected, that your bills are paid, that your family's taken care of. We've been doing this since 1976. We've helped injured people. We can help you.
Davis and Davis, attorneys at law.
We're back here on Inside South Union Township, continuing our COVID-19 series. Joining us is Dr. Jeffrey James, a resident of the Uniontown area, and he is the Medical Director of Infection Control and Prevention at the Uniontown Hospital. Of course, this is continuing a series of programs we have here on the South Union Township Network regarding COVID-19. The South Union Township Board of Supervisors developing programming to be aired on California University Channels 17 and 61, working with our medical community and key local officials, attempting to keep the public informed with pertinent information on how to respond to the coronavirus crisis. And this series of programming, again, airing on CalU Channels 17 and 61. If you have any questions, you can contact South Union at southniontwp.com. And Doctor, again, we've been talking about COVID-19 and some of the symptoms and treatments, and I think a lot of folks out in the area get mixed up a little bit because they don't know how serious they might have. Some symptoms, might have a sore throat, might have a cough, might have a runny nose. When should someone start to get concerned that they might have COVID-19 and the coronavirus in their system?
Yeah, no, I think that, if any of the questions we can talk about, I think that's one thing that, people want to sort of know about the most. So what are the symptoms, and what should I do about them, or who can I call, or who do I need to call? One of the real problems that we have with this virus, this illness, is that it's so similar to so many other illnesses that we experience. So, and also because there's such a wide spectrum of disease, meaning there's symptoms here that can range from some people can acquire this virus, and their body can take care of it all on its own and never have a symptom, to unfortunately, death. So we have that whole spectrum from being not sick to dying.
Yeah, you even go back
So-
a couple of weeks when this whole outbreak started. You had a couple of NBA players that had no symptoms, so somehow they were still taking tests.
Right.
Yet they were positive for it. And as you said, you have other situations where folks really, really are sick, and we've
Right.
seen obviously a number of deaths around the country because of this so far.
So we get to what's most common. So probably being asymptomatic is we're going to find out not the common thing. So what do most people have? Almost universally, everybody has a fever that gets this. If you don't have a fever and some other symptoms, does that mean you couldn't have it? No, but almost, if you looked at the statistics, it's right up there in the 90% range of those that have this disease have fever. So fever is number one. The second symptom that most people have is cough. So fever and cough are sort of the number one symptoms here. As far as overlap, other things that can start with fevers and cough are influenza. Our typical seasonal influenza virus can start with fever and cough. Some people developing sort of some of the common colds will start with fevers and cough. So there's really nothing specific about, I can't tell you, well, if your fever's, 102, that's more likely to be this than that. So the degree of fever is probably not that important. So what we do is we put together the fact that, well, this virus is circulating in the community. And so definitely if you have a fever, if you have a cough, you should consider that you might have this virus. Earlier on, if we went back maybe, 4 or 6 weeks, we might throw in there, well, did you travel anywhere, or you were exposed to anyone that you know of that had the disease? And we might use that as a gauge to be able to tell somebody or have them judge whether they might have symptoms. But that's sort of out the window.
Because obviously you got community spread.
Right, yeah, we got community spread, so we see people that have it that have no known contacts with anyone or traveled anywhere, so we know it's in the community. The symptoms, fever, cough, other things, body aches, sore throats, variably, it's a symptom. So any upper respiratory symptom with a fever could be COVID-19.
A little bit of flag there.
Yeah. You can't really even use the severity of those symptoms to sort of decide for yourself whether you may have the virus or not. Those are the symptoms. And so if someone comes to me and says, hey, I got a fever, I'm coughing, do you think I could have coronavirus? The answer is yes. The other question there is, well, when should I call the doctor, or when should I come to the emergency room or go get attention? If you otherwise are having symptoms that you ordinarily wouldn't call your doctor for, there's an argument to be made that there's really no need to call your doctor now. I actually saw a piece on the news of a New York Times reporter who had sort of self-videotaped her experience with this. She developed symptoms. She said, I know I have a cough. She's in New York City. She knows she had a cough, a fever, and but wasn't feeling that bad. If this were other times, she'd weather through, not call her doctor. She knew enough to stay home. And that's all really, as far as practically what she can do as an individual, or what we can do for her. We'll talk about testing in a minute. Recommending that she stay home until she's better, and recommending that she try to keep fluids down, eat, and get plenty of rest. There's no specific medication for this to give. It's not like the flu. The flu, if we know someone definitely has it, we got medication. Antivirals that we can give people that may shorten the symptoms.
Now, in her case, is it important even to be tested?
Right. She herself felt no, because she felt that she wasn't. Some people are comfortable with the fact that I probably have, I probably have this virus, and there's nothing more that's going to be done. If I don't have the virus, for sure, I can't go out anywhere, because you shouldn't. If you're sick, you shouldn't be going out right now.
Is it important, though, to the degree that she might have infected others?
Here's the point. There's the point there being, if there's a way that knowing that test is going to sort of affect others, and what they may do could be an argument for calling your physician to ask for a test, or calling your physician to get guidance as to whether you should be tested. At that point in New York City, there's such widespread community spread, the fact of whether someone had casual contact with her or not is sort of
It doesn't,
out,
yeah,
out-
the window.
sort of out
Yeah.
the window. She did have a boyfriend, and he got sick as well, so they both stayed at home. But he got sicker, and so they knew that after a day or two that he was getting a lot sicker, meaning he was getting more short of breath, his fevers were going higher, he wasn't able to keep fluids down. They knew that was a sort of a danger sign that they then sought medical attention, because that's something they couldn't handle at home. So to sort of reiterate, and we'll go back to what are the symptoms: cough, fever, body aches, sore throats. Some people start actually with upset stomach, nausea, vomiting, diarrhea. This is not, it wasn't all that well reported out of the Chinese experience, but if we look at all the cases coming through now, that there is reports of early symptoms of GI disease, meaning nausea, vomiting, diarrhea. I personally have seen that in my first case that I saw was a patient presenting with nausea, vomiting, and diarrhea and a fever, and then several days later developed respiratory symptoms. So that clearly has been described, and again, we always like to put statistics as things as how likely that is. Until all of this is over, we won't know exactly.
Yeah, it's
how
hard to get
likely
a
that
full
is.
case study
Right,
because
but
all this is so
definitely
fresh and new.
GI and the medical community is realizing that just because someone's starting with GI symptoms, nausea, vomiting, diarrhea, that actually may be an early symptom of the virus. So then we go to what I want to call danger symptoms. When is it imperative that you get medical attention? And then we'll go into the testing matter. So if you're short of breath, and you're progressively more short of breath, if you're dizzy, if you're lightheaded, that can signal that you're getting dehydrated. If you're going to stand up from sitting down and you're feeling like you're going to pass out, that's a sign that you may be dehydrated and need to seek attention. If you're becoming progressively more short of breath, then you may be developing signs of a worsening of a pneumonia. The virus can cause a pneumonia, and so that you need attention, and to be checked, you need probably go to emergency room at that point in time if you have those kind of symptoms.
Now, if you're going to come in, what's the general process? Obviously, we mentioned you guys have a testing center
Sure, if you're
set up at the old Kmart
right.
location.
If you're coming, if you're just having some of the symptoms, fevers, cough, chills, body aches, and you call your doctor and they want to test you, here in what we've developed here in this area through the Uniontown Hospital is that your doctor will order a test, and you'll get a prescription for that test will be transmitted somehow to the hospital, be it fax or so forth. We've tried to limit folks having to have to go out and get things to go to get tested, but there's a system for your doctor to get orders to that testing center, to the hospital, so they know that they can do a swab, a test out at that testing center that's at the old Kmart parking lot. That's if your doctor feels that these symptoms are manageable for you at home, and they want to test you and to be able to make some decisions about maybe family members or other people you may be in contact with as to whether to help to try to contain the spread of the virus. Ideally, people with symptoms like that, if they're tested, they know how to inform family, and there can be some public health benefit to that. If you're at home and you're sick, you sort of, at this time, I tell people to presume they have the coronavirus, and the recommendations are for folks to stay home if they're sick with any illness anyways. So even if you test negative for coronavirus and you have fever, chills, and you're coughing, I tell you to stay home,
anyways,
because you don't want to. Now's not the time to work through a cold. In this society of ours, we're sort of, there's a certain pride element of going to work when you got a cold or you're sick or you're working through it, which is really detrimental to public health, and in particular we're in the middle of a pandemic. So it's almost become not at what would at one point, years ago, where it's sort of like, you just got a cold, you got to work through it.
You can't call it sick.
It is right. So I think that is now, that mentality is completely shifted around, saying, well, why are you coming to work if you are sick? Because even if you don't have the coronavirus and you have some other virus, then if the other person gets that, then they're going to get a fever, then they're going to think they have, so it's just best to stay at home if you're sick, which, comes to the reason of, back to the question of, do you really need to be tested? No, you really don't need to be tested. If you feel that you can, if you're going to stay home, do what's right for yourself, because you should be staying at home if you're sick anyways. But if it's going to have an impact on others that you may be living with or working with, then I think you should speak with your doctor as far as getting a test. People have been, I think it's been a lot in these last 2 weeks or so. It's been a lot easier to get a test.
For sure.
Because we look back at just 3-4 weeks ago, I couldn't order a test. I had to get permission from the state health department to get a test. So, and there weren't a lot of tests to be had. So that is pretty much, that situation has improved. So pretty much here in Fayette County, if I feel as a physician I need a patient to have a test, we can get them a test.
All you need is a script, and like we said, with the old drive-through facility, it's pretty easy.
I know there's, also, if people are coming to the emergency room because they feel their symptoms are a little more serious, they'll be triaged. There's someone that immediately, almost in the vestibule of, the ER that identifies, what do you, are you here for, respiratory symptoms, in which case you go this way, and it gets you taken off to get the proper care and testing. We have a trailer actually over there they're doing some of this work in. It keeps them actually physically out of the emergency room. If you're a patient coming in with very severe symptoms, you will be triaged to the appropriate area with the proper precautions taken so that the proper management occurs, and you'll be tested, there. But we encourage people not to come to the emergency room sort of just to be tested. We'd like to have them go through their, physicians to be able to get tested, out at our outpatient center.
Now, if you're watching at home and you've been diagnosed, or if someone does get diagnosed down the road, obviously there's an isolation that occurs, 14-day period. What do you do to take care of yourself during this whole process?
Yeah, as an individual, it's pretty much, stay hydrated, drink plenty of fluids, try to keep eating, and just sort of stay in place. Take, fever-reducing medicines if your fevers are high and you're uncomfortable. Tylenol is, over-the-counter fever-reducing medicine. I'll put a point in here now. There's been information out there that maybe you shouldn't take medicines like Motrin. Motrin is what's called a non-steroidal anti-inflammatory drug, and there was some chatter out there about theoretically whether it might blunt your immune response to the virus. It's not been shown to be the case. There's not any evidence that happens. So, if you for some reason can't take Tylenol as a fever reducer, take, ibuprofen, Motrin. If you can take Tylenol, use Tylenol. If you've been on, like I had a question today from a patient's family member, hey, I take, ibuprofen for years, it helps with my arthritis. The advice would be keep taking the ibuprofen. So that's pretty much what you do when you're at home. As far as if you're at home and other family members are helping to take care of you, we like to try to isolate you in your home as much as possible, but not everybody has a separate wing of their house where they can, quarantine themselves with separate bathrooms and separate everything. So most people, are going to come into contact with other family members, but you try to, if you're going to do that, if you can, wear a mask while you're out and about in the house. Try to minimize the contact with a lot of surfaces and do a lot of cleaning and disinfecting of what we call high-touch areas. You know, doorknobs, toilet flush handles, those kind of things where, you know, people touch a lot. And that's pretty much, you know, what you can do if you're at home or if you have a loved one at home.
Now, if you've been diagnosed and you go through the whole treatment process, how long of a period do you have to wait before you can get back reacclimated with work and reacclimated back to the general public?
You know, for the general public, they're sort of more, we have sort of different rules in the healthcare setting, and I'm not going to go into those. They're a little more stringent than what we have for the general public. So in general, what's recommended right now is that if you've been without a fever for 72 hours, that's 3 days, without taking any medicine, meaning you've not been taking Tylenol in that time period or taking your Motrin, that you've been afebrile, no fever for 3 days, your symptoms are improving, so meaning that if you've had a cough, you're coughing a lot less, or whatever other symptom you had is improving, and then it's been at least 7 days from the time that your symptoms started. So some people might get better sort of real quick, but we still want those people to stay home at least 7 days. But that's the general recommendation right now. There used to be, at the start of all this, there was a recommendation that in order to come out of isolation, you had to have tests done to do that, meaning you had to have those swabs that go in your nose done on 2 occasions. Those recommendations for the general public are, for the most part, not followed. There may be unusual circumstances where someone would definitely need to know where a person doesn't carry the virus anymore, but most cases you wouldn't have to do that. So it's not a test-driven thing as to when you go back to work. It's a different story if we have somebody that's been in the hospital that needs to stay in the hospital, particularly if you were on cancer wards or around immunosuppressed people. We might have more stringent requirements for taking people out of isolation. But for the general public at home, it's sort of the 3-day rule, as long as you've been at least 7 days since you've been ill. Yeah.
And one thing that's popping up more and more now with the increased cases, we're seeing the possible exposure to somebody who has tested positive to COVID-19, or you might hear that somebody's neighbor that you might have saw at the supermarket had it, and I think that starts a whole snowball effect as far as whether you should self-quarantine yourself. What are some of the guidelines? Obviously, if you have a family member, you know you had direct contact with somebody who had it, but what about somebody 2 or 3 persons down the road where somebody's gardener had it and that you work with or something along those lines?
You know, it is a good question, and it's also, it's a good question, it's a difficult question to answer in some respects because some of the situations can be so nuanced that it sort of almost requires a case-by-case basis. I say that because I'm now, in addition to this work that I do at the hospital, I also work with employee health at the hospital. So I get calls every day from my employee health nurse about patients just like this, that, you know, or our workers that have been, you know, okay, worker X has been exposed to Mrs. Jones, et cetera, in a certain kind of way. So I'm almost on a case-by-case basis making decisions. But as a generalization, and I'll also point out what the public health departments are doing now that we have community spread is different than what they were doing, say, 6 weeks ago, when 6 weeks ago we were in high level of containment mode, where if we have one case, we're going to lock it down, we're going to lock down and contact trace every single possible person and lock them down and follow up with the health department would follow up with that. When you get to 4,000 actual cases and you imagine the number of contacts that might engender, so if even just one of those people contact one person, you're then, or 2 people, you can see how the numbers.
And that's why we're seeing the spread.
They head into the 8 to 10,000, you know, readily, easily, to not be able to practically do that kind of real-time sort of contact tracing. So we're out of the mode of what we call containment to the mode of what we call sort of the official word is mitigation, meaning sort of like slowing the spread. Whenever you can, you'd like to contain it as best as possible, and I still think we should stay conservative with those ideals to contain it as much as possible. Because on average, this virus, when one person has it, there's a certain number they attach to, well, how many others typically get infected? This number is like between 2.2 and 2.4.
Which is mind-boggling numbers.
So every one person that gets the disease, they on average may infect, 2.4 people. It's a statistic. That's why it's not like there's a half a person.
Yeah.
But
still, it adds up quickly. That's for sure.
Yeah, I mean, influenza is somewhere in the 1.5 range.
Yeah.
So anyways, so we try to look at risk. So high risk people are, if you're living in a household with somebody with the virus, then there's a high risk that you may acquire it. So the recommendations have been you should stay at home too, and typically it's 14 days.
Yeah.
Medium risk is then sort of, I've had close contact with somebody. Close contact is defined by this 6 feet rule. And this is where things are a little ambiguous, is for what's called a prolonged period of time. And that's sort of no one's wanted to define that. So they actually the best description of that is that I found was a few minutes.
Yeah.
And then I take a few minutes to be at least 3 to 5 minutes or so. It's so if we're in this room here, you and I have been here talking for
half an hour or so now.
Yeah, and we're probably not exactly 6 feet apart, so that might be a direct contact. Or some other people that are back further in the room, that's not so much. So our risk would be called medium.
Okay.
And there's been recommendations that if I had the disease and you were the contact, that you would try to stay home for 14 days.
Okay.
In the earlier days of this epidemic, that would be more strictly enforced.
Yep.
I mean, no one's making calls to you, no one's going to come to your house to say you got to do this.
I hope you're not showing any symptoms.
Nah, I'm perfectly, I'm fine. So, I think to be, socially responsible and given where we are, I think, and what I can recommend, knowing what I know, would be, try to stay home for 14 days. Obviously, if you're the sole person that can go out and get a grocery or something, put a mask on, but generally that would be my recommendation. What we don't worry about so much are what we call contacts of contacts. So if, using our example, if you go home and a friend comes over to your house tonight and you chat with them for a little while, they're sort of out of the loop.
Yeah.
You would be the contact of the person that's got disease, but a person because as long as you didn't have symptoms, you're just a contact. So that contact of you, that's a contact of a contact.
Yeah, I actually had a coworker today that was one of our on-air personalities that said that he works part-time at a car dealership. And somebody he had contact with 11 days ago tested positive. But he doesn't have any symptoms, and he hasn't shown anything.
So,
but I still told him just to stay at home for another week until he gets out of 2 weeks.
So you'd be a contact of a contact.
Contact of a contact, but still, it's just, I think we're seeing more and more of that, because the more, and at least I'm talking to folks out in public about this, they're seeing somebody else, and I'm sure you guys are seeing it as well, at the hospital, where you have contacts of contacts of contacts, and you wonder, at what point do I need to be concerned?
So it's really, we stop it at the initial contact. As long as that person's asymptomatic, it doesn't become a case, and then at which point you have a direct contact. So you're either contact of that patient directly, or you're not. So a contact of a contact, yes, it's wise to monitor your symptoms. We're not going to tell you to stay home. And that's why I would handle it, even if I had an employee working at the hospital. I'm not as, stringent with a contact of a contact.
Great information there.
I do want to go back to and this sort of goes right into this exposure thing, and I've had many questions about this, is going back to the testing. People ask me, okay, I just got exposed, I'm going to use our example here, you just got exposed, well, why can't I just go up and get tested tomorrow, and then I'll know whether I was exposed or not. And I wish that were the case, but that's not the case. So there is no role for testing when we're dealing with an exposure situation, as long as that exposed individual is asymptomatic. Here's the reason why. So, that we've all heard about what's called the incubation period of this virus. That's the amount of time that it would take for us to acquire the virus and then develop symptoms. Typically, it's, we typically are unlikely to develop symptoms before 48 hours after exposure, and then the incubation period goes out to about 11 or 12 days, okay? So to be safe, we added like a day and a half or so to that, to say we just, stay at home for 14 days, because maybe you could develop symptoms anywhere between,
just be safe.
It's just that, just because, so the virus could be incubating in you and just say, day 4, or say it's been 4 days since I was exposed. Well, why don't you test me now? And if you test me now, then I don't have to sit around in isolation, because you might think this if you watch the television. You might think, well, geez, these people were on the cruise ship. They don't have symptoms. Why make them sit somewhere for 14 days when you do a test? The problem is that negative test, although it's meaningful in the minute that test was done, doesn't mean that symptoms couldn't show up the next day or 2 days from there.
And you get a positive down the road.
The test is not, the test may be negative if the disease is just incubating. There might not be enough viral load, enough virus yet to have infected enough cells to show up. So, although if it was positive, if the test was positive,
then
that would be useful. But given the fact, and then you're going to quarantine, and you're being quarantined anyways. But if the test is negative, it doesn't help us to say you don't. The test isn't able to tell us in an asymptomatic individual that may have been exposed that they're negative. So they still have to be quarantined for 14 days.
How quickly are you guys getting these tests back locally?
Right now it's about 24 hours.
Okay.
Which is a lot better than 8 days when we
sure.
started testing people. And that time hopefully will get reduced further. There may be some ways that we get even faster turnaround at the hospital, so that would also be helpful.
What's the best way to stay protected right now if you're out and about in the public?
Yeah, I think the best way to stay protected is stay at home. So if you stay at home and stay away from sick people, stay away from the public, that's the best way. So unless you really need to go out, then that's the best thing to do. I'll just sort of use, one of the more common places that we have to go is a grocery store. So I'll sort of just use that as sort of an example of, what should you do if you're going out to the grocery store. I've already talked about gloves. I do not favor wearing gloves in public in this situation because I think they give a false sense of protection. If you're going to wear the gloves throughout your whole trip through the grocery store with never changing them, it's no different if you just had your hands there, because you still going to have to wash your hands as soon as you take those gloves off, and when you're in the store you still might be touching your face, etc. So I find not too much use of gloves in public. I personally don't wear gloves when I go to the grocery store. So what do I do when I go to the grocery store? First thing I look for is a sanitizing wipe to wipe off the handle of the grocery cart. Those have become scarce right now. I was actually, that was one of my main things when I went to the grocery store before any of this happened. I was sort of obsessive about what, because I think that was a terrible, that's like really, talk about a place that gets germs on it. Some of the places have had provided spray bottles now where you can wipe that down. I think that's a good place to start. You've got alcohol hand gels, take them with you, sanitize, through your shopping trip. If it's a short trip, just, when you get home, wash your hands or get to the car and use, some hand gel, or really just the good old soap and water when you get home. I think the one question that everybody wants to know about is, should I wear a mask? So masks can be protective. I mean, this is what, and I think actually the federal government now is looking at whether they're going to change guidelines on masking. So even when we're done with this session, there may be new guidelines out on masking.
That's the whole thing with this whole process.
As soon as we're done talking, yes. So I feel that, knowing what I know, knowing how this is transmitted, so what can a mask do? One thing a mask does is if you are sick or if you're just starting to be sick, it can prevent those droplets from spreading, to other people.
Yeah.
So it really can be effective if you wear the mask to prevent spreading the disease to others. And I think that's a very valuable thing. So I think wearing a mask is protective from that standpoint. Can the mask protect you from getting it from someone else? I do think it does offer protection. I know there's been information out there, and I think it's correct to say that the mask is not 100% protective, and that's true. And does it give you a false sense of security? Maybe it does, but I do think that, and I think most of the public health experts, when asked to look at the science and give a rationale, there is a rationale that wearing a mask, if you're going to be in public and you can't practice the strict, distancing of 6 feet, that the mask can be protective.
And I think a big question, though, for people, where can they get them at now? Actually,
well,
I had my father ask me this morning, and he had a case of aspiration and pneumonia a couple years ago.
Right.
In his mid-70s.
Yes.
He's considered, I think, medium
Yeah,
high
I mean,
risk. And he said, Brian, do you think it's the time where I should start wearing a mask? So
Yeah, I mean, I
you
think-
start looking around somewhere and you can't find them, though. That's
Right,
the
and
problem.
I think that's, I think it's perfect. I, as a scientist and physician and knowing how these things spread, I think that the mask can be protective. And so having a person like your father wearing, a mask is wise. Because when they're, it's going to prevent that direct coughing on you. What it won't prevent is, and I didn't talk about this, is we talked about droplet transfer and we talked about contact and touching. What I didn't mention is, and this word is out there and you'll hear it, is what percentage of this disease is transmitted through aerosols, okay? So what's an aerosol? Well, when we cough those big droplets out, and most of them fall to the ground, some of them are small enough they actually start to evaporate before they hit the ground, and they float in the air, okay? So they can float, those small droplets can float in the air, and they can stay suspended for a little bit of time, and they can carry virus, okay? And it's variable as to how much virus will live in those small drops. And there's certain diseases where that aerosol kind of transmission, where the germs stay living in those really small drops, and then we actually breathe them into our lungs. These droplets that I'm talking about, we're not breathing them in. They're landing on our mucous membranes, okay? They're landing on the insides of our mouth. They're landing on the insides of our nose. The aerosols are actually getting breathed into your lungs. And a classic example of that is tuberculosis. So tuberculosis is airborne spread almost 100%, which this virus is not. I want to just make it perfectly clear. This virus is probably minimally spread through aerosols, though they're not sure exactly, and that's a little dependent on the situation of airflow, air currents, where you are, how much virus you're coughing out, et cetera, et cetera. So there is a proportion of this transmission that isn't droplet, isn't contact, but it's aerosols. What we, like, if, I'm sitting a little further from you and we had a really small room here, that some of that stuff could be floating around. And if I had a mask on, a regular surgical mask doesn't prevent you from breathing in aerosols, because that's small stuff and it's going to go through the sides. It's thought that that's a minimal way of it being transmitted. That's why you'll hear people talk about these N95 masks for people that work in the hospital. Those filter out all that aerosol. But it's felt that that's, for the general public, that's impractical because there aren't enough N95 masks for people that really, really need them. But surgical masks, there also can be in short supply, which is why there haven't been, the global recommendations for everyone to go out and get a surgical mask to wear, because there just aren't enough. There may be more coming, but in every region's different. So, if you have a mask, I think it's reasonable to wear your mask. You got to be mindful that you can, some of these paper masks, if you wear it too much and people have been coughing on it,
Yeah, you're
get
gonna
stuff
get-
on the
yeah.
outside, so you can sort of that
Kind of like the whole
becomes
glove
useful.
theory.
Yeah, exactly. So that's why it's not, it's not 100% protective. It's probably better than doing nothing, but you could actually, if you do it improperly, you keep wearing the same mask over and over again. And
You're
didn't
back to
take-
square one, yeah.
Yeah. I mean, there are people making homemade masks. So I was asked questions about, are they any good? Is it any good to wear? Yes. I mean, the homemade masks are not as good as, they're not as good as an N95. They're not probably as good as a regular manufactured surgical mask. But they can provide some protection against those droplets, hitting you preventing them from hitting those mucous membranes. And, I've seen some wonderful ones made that are washable and, you can take care of in that way. So I don't see any harm done. If you have, these are, I've seen that there were, I saw about 5 of them in my department the other day that somebody had brought in. And they're, so there is an option to wearing self-made masks, options to wearing bandanas, something to prevent those droplets from landing on you or prevent you from coughing them out.
Now, I know we've seen some vaccines currently being developed, nothing really on the horizon that's been approved. You mentioned as well, treatments limited to some degree as well. Let's go through the whole process, talk about the vaccines that are in development and the bottom line treatments as far as where we're at this point.
Right, so bottom line, there are no treatments for this virus right now. So, there's no treatments that have been shown to be of any benefit for this virus. Now, to sort of temper that with some positive, is that they're working on studying a few medicines that may be effective against the virus. One that sort of got out there in the forefront, has been in the media, was mentioned by the president, was this chloroquine, hydroxychloroquine combination. Not a combination, they're 2 separate drugs. They're both, chloroquine is not as readily used or available here in the United States.
Is that the one to treat malaria?
Chloroquine is an anti-malarial.
Okay.
So is hydroxychloroquine. It's otherwise known as Plaquenil. It's that one is available. It's used. It has other uses. In the United States, Plaquenil is probably most commonly used in patients that have lupus and rheumatoid arthritis and some other rheumatologic conditions. Its effects are somewhat anti-inflammatory. They knew from past studies, we talked about the SARS #1, they knew from the SARS-1 virus that when they did tests looking at hydroxychloroquine in the lab, it sort of killed the virus or slowed its growth. But there's really never been any good studies to show that outside of the lab that this agent works in treating the virus, making people clinically better. It really gets, the studies get, interpreting the studies, evaluating that, get very complicated, but I can say that Is
it worth trying in a very severe case where somebody's kind of on their last leg?
Yes, it is, that's where it's being used.
Okay.
It's used with caution though, because it can have side effects in those populations, it can have effects on the heart. So if you're prescribing it, you have to be well versed in what the side effects are, what it may or may not do, could it potentially cause harm. We don't even know what the proper dosing regimens would be. We can say the drug is relatively safe from other populations that have taken it, but it's under study. Vaccines, they're under development. It's just that they have to be tested for safety and effectiveness before they can be released, and that can take up to a year. Unlike if you remember back to 2008 when we had this H1N1 outbreak, we were able to get the vaccine for that ramped up better because we already have the experience in making every year we make a new influenza vaccine, just adjusting some of the components. So the process for that was the same when they made this new vaccine back in 2008 for the H1N1 influenza virus. So they didn't have to go through as much testing, and they didn't have to go through as much, regulation as they do for this. Because the one thing you don't want to do is give someone a vaccine and have it, do bad things to them,
for sure.
and then make them better.
Also, a lot of false information out there as well. You see so much posted on the internet. Hard to sometimes decipher between what to believe and what not to believe. Obviously, you want to try to follow credible news and medical organizations like the PA Department of Health and
Sure.
reputable news organizations. But how do you know what's out there that's true and what's false out there?
You know, I recommend trying to, stay to, like you said, credible news sources, and anymore that gets harder and harder to identify. I do feel, if there are treatments, like no one's hiding treatments from people, and I think the CDC, the Centers for Disease Control website, the Pennsylvania Department of Health website are very forthright as far as where we are with treatments and what works and doesn't work. So if it's some kind of treatment you read about that's not listed there, it's likely not a valid treatment. I mean, I've seen anything from, questions about, what if you lavage your nose out frequently, it's like these nasal lavage things that can be helpful. That's not. Going in a hot sauna could kill the virus. That's not gonna work. Eating garlic, that's not going to kill the virus. I mean, it may make you personally offensive to people that they want to stay away from you, but other than that, that's not going to help. Some other, I already talked about the ibuprofen issue. There was another issue about not taking a certain blood pressure medicine called ACE inhibitors. That's found not to be true. If you are on a blood pressure medicine that's known as an ACE inhibitor, I take one myself. I'm keeping taking it. You should keep taking that medication. Mail packages, not really been found to be a way that this can be transmitted. Animals, it's debatable whether your dog or your cat, whether the virus could live a little bit in them. It's not going to make them sick. Whether it could transmit to a close family member, probably not, unknown. Just, if you're sick, I wouldn't have the dog licking at your face is
For
what
sure.
I'd advise, yeah.
I think another question everyone wants to know right now, how long is this whole shutdown going to last?
Right.
That we're seeing a devastating effect, I think, from a business and economic standpoint with small businesses. You see restaurants being limited to takeout only, most non-essential businesses in the state shut down here for a long period of time. Looks like it's going to continue for a while. When is all of this going to end, and when are we going to actually reach our peak to try to kind of get on the other side of this a little bit?
Right. So, had we been doing this interview like at the end of last week, it would have been harder for me to sort of at least say that, because at that time I would have said, well, I think, because at that time everyone was saying 2 weeks, and at that time I would say, well, it's got to go on longer than 2 weeks. They've set this April 30th deadline. I mean, that's about 6 weeks into it. I think the answer there is we can't necessarily set an artificial date. The virus will sort of let us know when we can safely start to return to our activities. That means when we start to see that we're seeing declining cases and that it looks like we're through the peak and cases are declining is when they may be able to relax these restrictions. Definitely, I think going out to April 30th at 6 weeks, from the experience, it's hard to extrapolate some of the experiences that occurred in China or other countries because each region is different, and unfortunately we can't be 100% certain as to what really is going on in China. They probably took a 12-week period of time before everything was coming down and settling down, so that 8 to 12-week period. So would I be surprised if after April 30th there's recommendations for another 2 weeks? I wouldn't be surprised. It's just a matter of how much we can absorb as an economy, and that's sort of, they're complicated decisions to make, and that's sort of not just medical but societal decisions that need to be made.
Dr. Jeffrey James had some great information. Any final advice to folks out there before we wrap things up?
Yeah, I think that, my first three, numbers 1, 2, and 3 on my advice are stay at home, and stay at home. As hard as that can be, that's the best thing to do. I really encourage, following what the public health experts have to say. Don't overdo it on the news, though. Minute by minute, I think you can get saturated with that. We do have some of the smartest people in this country that are here in our country, but they're the smartest in the planet that give advice to the president. And I would say that, people may not know names, but Dr. Anthony Fauci, that's not a household name to you people, but as an infectious disease expert, that's like the top of the field. He is probably the most respected physician in our community, in the infectious disease community. He's been around doing this a long time, and I think he's spot on with his advice. So, I think that, if we just do, I know it feels like you're not doing anything, but I think if everybody does their own little part, then we protect those other people in the community that are vulnerable, our parents, those people that are older in the community, those that have other illnesses. We keep the cases down and then we don't overwhelm the health system. I mean, that's really the name of the game. So, just stay at home.
Great information. Doc, appreciate you taking the time to join us.
Thank you.
Yeah, it's Dr. Jeffrey James, Medical Director of Infection Control and Prevention for the Uniontown Hospital, joining us here on Inside South Union Township, which has been a joint cooperative venture featuring Township Supervisors Bob Schiffbauer, Rick Vernon, and Jason Scott, Atlantic Broadband Cable, Armstrong Cable, and our friends at CUTV, including Gary Smith. For Dr. James and Jerry DePay behind the camera, this is Brian Morozak. Stay safe and have a great day.